There's also some amazing work done by Dr. Sahloul recently coming back from Yemen. I'd love to hear about some of that work and how it kind of ties into your global mission. If you could elaborate a little bit on obviously another incredible humanitarian crisis that is getting even less attention than the Syrian conflict.
I mean, definitely, and I think the bottom line, and sometimes we may have disagreement about numbers and here and there and policy and politics, but I think what unites us humanitarians and our model is the Red Cross, Red Crescent movement, is the fact that we are neutral and we are impartial, and we believe that you have to save every life, no matter whose that life is related to, and regardless of the affiliation of that life, whether you are a person who lives in Tartus or in Idlib or Deir ez-Zor or in Yemen or a Rohingya, every life is precious. So we started a new organization with some of my colleagues who had experience in Syria, actually. One of my colleagues, Dr. John Kaler, who's a pediatrician from Chicago, and Dr. Anushi Baraju, who volunteered in Jordan and Lebanon. She's a cardiologist. We started an organization called MedGlobal, where our vision that we should not have a globe with disparity in healthcare. We believe in a world without disparity in healthcare, and that's why we're sending medical missions to areas that are hit by disaster. I just came from Yemen 4 weeks ago, and Yemen is in a war, of course, and it's the worst humanitarian crisis that we are living right now, according to the United Nations. I mean, some of the numbers in Yemen are biblical. We're talking about 800,000 people in Yemen who had cholera. Cholera is a disease that maybe most of us in medical school, who went to medical school, forgot, because we don't see cholera anymore. But 800,000 people in Yemen are suffering from cholera. And I visited one of the cholera treatment centers in a city called Ma'rib. And the same consequences of war that we've seen in Syria, we're seeing it in Yemen. So we have a large number of people who are injured because of the war, and that's draining the resources of the Yemeni authorities and Yemeni government, because most of the resources are directed toward treating these patients who are injured and had amputations and who need rehabilitation. Then that means they're directed to treatment of non-communicable diseases or chronic diseases like heart conditions and diabetes and hypertension and cancer are not there anymore. So many patients are dying with NCD. Dr. Annie Sparrow had mentioned that, but I think we should not forget that what kills most people in war situation, even in developing countries, are NCDs, not the war itself. NCDs mean heart condition, diabetes, and cancer and kidney failure. And we have to put more resources on this. More people died in Syria because of NCD than the victims of the war itself, and the same thing in Yemen. In Yemen, the healthcare infrastructure was not developed as it was in Syria before the crisis. And they had huge shortage of healthcare workers, and they are in need for assistance. The problem with Yemen is the access. It's very difficult to access areas in Yemen. Even when we went, our medical team, we had 4 physicians who went from Chicago. Our flight was unpredictable because they told us that we can cancel your flight anytime. And you can get into Yemen and sometimes you don't know whether you're going to be leaving or not. And you cannot get access to every area easily. So I think this is something that we had to put pressure on the Yemeni authorities from both sides to allow NGOs and humanitarian to get into Yemen. People of Yemen are very hospitable and very welcoming, and they told us that you came and broke the barrier of fear, and we appreciate what you have done for us. We had baggages with us. We took with us 8 bags of medical supplies and medicine, donated it to the hospitals in Ma'rib and Aljarah city, which is not far from the front line. We saw many children. We had 2 pediatricians with us who saw children with cerebral palsy. Sometimes mild investment in country that has low infrastructure will help saving a lot of life. Sometimes, we spend millions of dollars to save 1 life in my hospital, which is true. I mean, we are the best country in the world in terms of healthcare. But sometimes you spend a few $1,000s in a country like Yemen or a refugee population like in Rohingya, and you save tens of thousands of lives. And that's what is needed. We have really to pay attention to these areas. South Sudan is the other area, and other places in Africa and Latin America that are in need for our attention and investment in the human being and saving lives and paying attention to every child, whether the child is in Yemen or a child of Rohingya or a child in South Sudan or a child in Chicago. It's the same soul. And we all came from faith communities that we believe that saving one life as if you save the whole humanity. And I think that's what we need to pay attention to. Governments can fail, the UN can fail, but we should not fail people of Yemen and Syria and South Sudan and Rohingya, and every one of us should have a responsibility.
Thank you.